Hello, everyone, and welcome to the webcast. My name is Christine Dorsey Davis. I'm the Executive Director of the Ohio chapter of the American Planning Association, and I am your webcast moderator. Today is Friday, October 15th. Yes, the 15th, and we will hear the presentation, The Health Benefits of Active Transportation. For technical help during today's webcast, you can type your questions in the questions box located in your GoToWebinar tool panel. For your content questions related to the presentation, just again, type those in that questions box as you think of them, and I will gather them together and we will answer those at the end of the presentation during our designated time for Q&A. Coming up next on your screen is a list of our sponsoring APA chapters and divisions for 2021. Thanks to all those participating sponsors for making these webcasts possible and free to members. Today, we are sponsored by the Florida chapter of APA. So thanks to you for joining us and for hosting today's session. Coming up next is a list of some of our upcoming webcasts. We are booked for all of our Fridays through the end of this year. And we have started taking on some Wednesdays. I think we might have another Thursday sprinkled in there. So as I get the information I need, I set up registration and post links up on our webcast website, ohioplanning.org/planningwebcast. So you can visit us there and register for these and more sessions that we have coming up here through the end of the year. Today's session has been approved for 1.5 CM credits for live viewing. To log those credits, just head over to planning.org, log into your My APA account, and from there you can either search by today's title or event number to log those credits, both of which can be found on our webcast website. Again, ohioplanning.org/planningwebcast. If you're on social media, be sure to like us on Facebook. Just search Planning Webcast and we'll pop up. That's where I post any kind of timely information like date or time changes. I'll also post when we have new sessions available for you to register for and reminders about our weekly upcoming session. And YouTube, subscribe to us. We record all of our sessions and post them on our YouTube channel. Again, just search Planning Webcast and we'll pop up. Along with well over 350 recordings that we have. So subscribe to our channel and you'll get notified when I post a new recording up on our site for you to view. That is the end of my housekeeping items. Again, as you think of questions for today's panelists, just type those in the questions box and we'll get to those at the end during the Q&A. So with that, I am going to turn controls over to today's panelist. Let me get my change presenter, Jason Jackman. All right, the controls are yours.
Okay, sorry about that. There we go. Okay.
There you go.
Thank you. Sorry for the delay. Very happy to be here today and talk about active transportation and health. My name is Jason Jackman. I'm a senior research associate with the Center for Urban Transportation Research. I've been working with the Center for Urban Transportation Research for a little over 14 years. My experience is pedestrian and bicycle safety and micromobility, education and outreach, anything that has to do with either vulnerable road users or just active transportation. I've been involved with that. I'm going to talk a lot about the programs I've worked on over the years, specifically in the Tampa Bay area or around the state of Florida. So some of these best practices I've worked on, or just programs I've worked on, you may have done in your own communities, but this is more non-infrastructure type education and what's out there. But I will talk some infrastructure when it comes to walking and biking. But yeah, again, happy to be here. One thing I I did prior to working at the University of South Florida at Qatar I worked for Hillsborough County Parks and Recreation Department, and that gave me an opportunity to work with communities in my county, work with neighborhoods in my county on promoting just activities in the community and at the parks, and it was so exciting. I got to connect with people from all ages and walks of life. And one thing I found, though, working especially in my community, was just the lack of connectivity and transportation, the lack of awareness that the car doesn't have to be the end of their transportation. And there was just that lack of knowledge. And that really got me into transportation. I felt like people need to know that, hey, we can walk, we can jog to our destination, we can ride our bikes to our destination, we can carpool, stuff like that. So I was very excited, and that's what got me onto my the Qatar path. Today, I'm going to talk about active transportation, some bike ped safety from the local and statewide perspective. There are some safe routes to school elements here. I think it's so important. It's a big initiative in Florida still, and there's a reason for that. And part of that is really just starting from a young age, getting kids walking and biking, getting that culture change for active transportation. There's many partners we've had, including Florida Department of Health, and encouragement programs that we've done just previously and are continuing to do, like Love to Ride. And you may have heard that it's a growing program, not only in this country, but around the world. And then finally, health and all policies. This is something that ties into the way we look at how transportation connects us to our needs and gets us out in our communities and creates that connectivity. With the first question, and I'm not really looking for an answer here, it's more rhetorical. I guess, what does your community need to do in order to be more active transportation friendly? And this could be anything from, if you follow from left to right, it could be from bike to school days. Is the infrastructure there for that? Is the encouragement there for that? Is there an awareness of an option for this in the communities? The middle picture is infrastructure improvements for walking and biking, or even scooter riding, e-scooter riding. So it is something there that makes it more transportation friendly for your communities. And then finally, education. You're talking about, transportation, active transportation. Well, do you have people set up to really make these announcements, to do this outreach and education? Because one thing is, you hear that saying, it's like riding a bike. Well, what if someone hasn't been on a bike before? It's been a long time and they're not aware of the laws and the rules of the road. Do you have a community outreach coordinator to do this kind of stuff, to really encourage people to get out and ride their bikes and do it safely, or even walk and jog? So that all has to do with active transportation. And if you have all three of these elements, just that education, encouragement, infrastructure, you're well on your way, and you may already be aware of that. But I have some examples that may inspire you to start these in your community, or just rethink the way you're working in your community and planning your community. So active transportation, again, consider it any self-propelled, human-powered mode of transportation, such as walking and bicycling. Physical inactivity is a major contributor to the steady rise in the rates of obesity, diabetes, heart disease, stroke, and other chronic health conditions in the United States. And I think we're all aware of that too. We have to be active in our communities. We have to be active in order to lose weight. It's not just about our diets anymore. It's really about getting that physical activity. And I'll have a few slides at the end of this presentation on maybe what you can do to think about your health and what you can do daily, or every so often, to increase your physical activity. The third bullet point here is infrastructure that promotes active transportation. And you're probably asking yourself, well, how does infrastructure promote it? How does infrastructure promote, people to get out and ride? Here's just a few photos that I put together of, infrastructure that you may not consider, like, oh, well, we didn't think about this, but it's bike lockers. You might have someone that says, well, I don't want my bike to, stolen if I ride my bike somewhere. Bike lockers promote that out of sight, out of mind thought, where if you lock your bike up in a compartment, it will less likely be stolen because they don't see the bike there. But it also, I'm in Florida, so you have the elements year round, from heat to rain to humidity, that can really destroy a bike. So someone might say, well, I don't want to ride my bike and, it's going to rain all over my bike and it's going to rust, because it does happen. Rusty bikes are very frequent in Florida. But yeah, it's promoting active transportation by encouraging someone to lock their bike away. Something as simple as that. But you also, in this top left photo, you have a transit station next to a bike locker. So you have two modes of transportation connected to each other. And so this honestly promotes somebody just leave their car at home and ride their bike and take the transit to the next destination. Other items on this slide include, let's say, the protected bike lane or the cycle track on the top right. Something like that. Maybe the bicycles will be encouraged and feel safer away from traffic while riding their bike. Bottom left, we have bicycle racks in themselves. So yes, believe it or not, bicycle racks can promote and encourage active transportation, more people to bike. If you don't have a place to lock up your bike, that can cause an issue. That can cause maybe barriers on the sidewalk for pedestrians. So, and then you have someone say, well, look at all these bikes. People are riding their bikes. I'm going to do this next time if they maybe have driven their car. The bottom two photos, again, we're promoting active transportation. How does infrastructure do that? You have roundabouts and bike sharrows in the bottom right corner. So what does this do? How does this promote active transportation? Well, the first thing that stands out to me is that we are reducing the speed of motor vehicles. And with roundabouts like this in the center, you cannot go fast here. It's almost impossible. There's fewer points of contact between the pedestrians and the motorists, and motorists have to slow down. So this is encouraging. Again, this is an encouraging piece of infrastructure. And in the bottom right, again, the sharrows, the installation of sharrows coincides with the speed limit of the roadway. So typically in our communities, it's 35 miles per hour. So that's very encouraging to be a cyclist in the road, follow the rules of the road, and share the road with the motorists. So again, we're thinking about infrastructure and how it plays a part. But then part of active transportation could be that low-hanging fruit, the very cost-efficient countermeasures you can do to promote walking or even biking. And paint can do that. And I'm pretty sure most of your communities that you're working with are using paint as just a simple option to create beautification in your communities, community pride, better connections, and then you have the safety and encouragement. So there's a lot of examples of the way communities are installing paint, whether at the intersections or the crosswalks. These are locations in downtown Tampa Bay with the city of Tampa. And we're going to see more of this, because if you think about it, it really does bring this community pride to the centerfold and more people out there. So when you talk about active transportation, you're giving people a reason to be out there in their communities and be around in the area. So it's just a small example. And this is a school that painted their sidewalk, and also they have this nice mural along their walkway into the school. And so I have more school information with the safe routes part of this presentation, but I mean, it's just a beautification point, but again, you're encouraging people to take the time to walk if that's an option, and you're getting them thinking outside the box as pedestrians, rather than just, hey, I'm in my car today. I'm just going to do that to school, drive to school. So why active transportation? And I've kind of talked a little bit about the infrastructure, but why are we here? Why am I talking about active transportation and how it relates to your health? Well, in Florida especially, and this relates to many other states too, but in Florida, only 36% of adults are at a healthy weight. and by 2030, almost 60% of Floridians will be obese. And so yeah, we know this is a problem. It's a huge issue in many of the states in the United States, but it's something that needs to be addressed, and part of that is improving our infrastructure for our modes of transportation that include walking and biking. And yeah, I think our communities are really connecting the dots here, and they're thinking together, like, what can we do to promote connectivity, but also promote physical activity through our transportation network. Here's just another slide about the obesity issue throughout the U.S. This is self-reported, by the way, but the overall obesity not broken down by race and ethnicity. So just to let you know that. But all states and territories had more than 20% of adults with obesity. 25% to less than 30% of adults had obesity in 13 states. And one thing we talk about obesity, but the newer kind of dialogue that's happening now is heart disease. You know, we're really opening up about heart disease. It's the leading cause of death in the United States, 1 in 4 deaths in this country. So while we do talk about obesity, technically you don't have to be super overweight. You know, sometimes genetics does play a part in the overweight factor, but you know, when you talk about heart disease, if you're not physically active, if you're not active getting that heart rate up, you know, that is part of the heart disease issue. And sometimes it's genetics, but for the most part, it is preventable, especially with the heart disease, stroke, type 2 diabetes, and other types of cancer. So a lot of this is preventative through physical activity. So this is a good reason for our communities to really connect our communities with infrastructure that promote active transportation. And just to let you know the cost, the estimated annual cost for the medical cost for obesity in this country, and this is from 2008, but it was $147 billion. So there is a huge interest in really fixing the way we do things, the culture and the mindset we have of improving our physical activity. And we're seeing a lot of our cities take charge on ways to promote active transportation and really build this safety and health culture in our communities. So this leads us to different active transportation programs you can do, or you probably already have done. However, there's a handful, you know, just a ton of other resources out there where you can just, you know, take to your community. Here's just a small sample, like safe routes to school, different mobility programs you can do throughout your state, health and safety initiatives, especially some that I've been a part of recently. Community walkability, you know, we made this walkability community program, just thinking with the Florida Department of Health. We're like, hey, let's do something like this together with all our partners. And I have a few slides later about that. And then even encouragement programs like Love to Ride, and I'll talk about that in just a moment. I had the opportunity to work with the Safe Routes to School program in the Tampa Bay area for several years. I think it was close to 7 or 8 years. And it was designated as a walking school bus program and a bicycle train program. But the thing is, you don't just start from scratch. You don't just say, hey, we're going to get parents and kids riding bikes and walking in groups every day. You have to create a new dialogue. You have to really, you know, build a relationship with the school system and the principals and each school. So it took a lot of effort to get that encouragement out there and educate the families on walking and biking to school, whether it's a walking school bus or bicycle train program. But at the time when I started this, the obesity factor was definitely weighing heavy with our schools and the kids and in our communities. So it was a huge thing with the Department of Health. They knew something had to be done. Part of the reason Safe Routes to School was there, not just for safety, but just really get kids out walking and biking to school as a way to counteract the obesity epidemic. So what will that take? What does that mean? And what does walking to school look like? Well, walking 1 mile to and from school each day is 2/3 of the recommended 60 minutes of physical activity per day for a child. So if you live a mile from the school and you have the connectivity to sidewalks and maybe even bike lanes, it's a good option. And one of the things we did with the schools we worked with, we had walk to school day events. And just last week was International Walk to School Day. Actually, it wasn't last week, but it was October 6th is International Walk to School Day. And so something like that starts the engine for our communities. You organize a walk to school day, maybe you have a meeting point at a local park and you get parents to meet together and you all walk to school together. That's just one option. Or they just walk to school on their own. The thing is, you have families that can participate, they can meet each other, they can decide, hey, I like this option. I kind of want to do this again. I can do this because my schedule allows it. You don't get a chance to do a test drive of programs like this. You don't get a chance to do these walk to school day events unless you organize them. So it was really neat, and a lot of the schools I've worked with are continuing to do this. So it's somewhat sustained within the school system because they know that they've had their walk to school day. So one thing I encouraged parents to do before each school year, and this is a communication effort with the principals, was get the parents out walking and biking before school even begins with their kids. See if it's a good route. See if it's something they want to do before the school year. So, parents and families aren't going to really realize the importance of walking and biking, and they're not going to realize the options out there unless you promote it. So it takes a lot of outreach and education to get the word out that walking and biking to school is an option. It's a viable option. And the other thing that I like to say is with kids, if they haven't done it from a young age, they haven't experienced it. So while we're trying to promote active transportation at an older age with adults now, walking and biking to work, carpooling, unless they do it when they're younger, it's really hard to change that behavior. So as I mentioned before, when you're working on safe routes to school programs, one of the benefits to promoting these kind of programs is to start at an early age, to really have these behaviors early on. So later in life, it's not a big surprise or it's like, no, I'm not doing that. So that's one of the reasons why we really promote safety education too in our classrooms throughout the state of Florida. It's because we want our pedestrians and bicyclists to be safer as they get older, and we want them to be good drivers too. Continuing with somewhat safe routes to school, we did have an infrastructure project a while ago, and this relates to active transportation because the schools we were working with, there were 2 schools in the area. There was a middle school and an elementary school, and the students were bused to this school. And it was somewhat of a rural community, but over time, developments around the school and the neighborhoods were building up. However, the sidewalks were lacking, the connectivity from the neighborhood to the school. So the Safe Routes to School program had infrastructure funding for the local county and for planning and development and installation. However, the community was like, well, if we have this sidewalk, we're going to lose our busing. And that wasn't the case, but it's that misinformation that really led to some pushback from the community. So we had our Florida Department of Health expert come in and talk about walking and biking, why it's important walking and biking to school. And I mean, this was a packed room. People were concerned, and it was a really good effort and coordination of bringing local partners together to really tell the story of why active transportation is important, why we need to do this. So the construction happened, and we were continuing the outreach and saying, hey, this is what's happening. It's going to be this is the timeline for construction. And some local residents were still not sold on it. Well, eventually the construction was complete, and not only were kids, families walking and biking to school, But just down the street, where there was a connection that continued, there was an ice cream store, there was a shopping, a grocery store, and they were walking to these locations. So, you think if you try to not sell it, but say, hey, listen, this is something that's going to benefit your community, and now you have an option, an active option to walk and bike safely from point A to point B. And it was a really good best practice on how to bring the community in before any kind of planning or infrastructure was, considered. And again, this is somewhat a few years ago. I think this is maybe 13 years ago. But it was a lesson learned that a story needs to be told, and you need to have really some compelling evidence that of the benefits, and there are many benefits. But now it's more streamlined into the planning process of not only planning a sidewalk and different infrastructure, but also installing. So it was a good lesson learned for the local community, but also for planners and engineers too. I think, and so many benefits now. It's a better connection. Continuing with active transportation and safe routes. Again, I had the opportunity to work on a non-infrastructure project for many years. There were safe routes to parks, been involved with shared use agreements, at one point called joint use, now they're called shared use, same thing, somewhat. Policy changes that were involved and the equity involved with these changes. Now this school that I worked with here, it was within the city of Tampa limits. And it was a partnership between the City of Tampa Recreation and the school district. The after-school program was a city program down the street, about a mile away, off school grounds. And you don't see this too often, or at least I don't see this too often. I mean, I've worked with several schools and this happened, but I'm not sure how this works in other schools around the country. But the city recreation leader who worked at the city park down the street a mile away would pick up the students after school and walk them, like a walking school bus format, a mile away. And they did this every day. It wasn't, and they're not going to have a bus taking them a little less than a mile away, but they're not going to take a bus from the school to the park when there's clearly a sidewalk there. So there's an agreement between the city and the school district to have the students walk with the recreation leader, and there was always 2 recreation leaders. So, and I got a chance to walk along the sidewalk. Kids were happy, no complaints. It's a habit. You have these habits that you do every day, and they didn't think twice about it. They weren't like complaining and saying, I wish there was a bus that was taking us down the street. It was just something they do every day. And I've worked with several other schools that had the same policies in place. But again, it's that little bit of physical activity that you can do, and these kind of agreements that you have with your local partners that can really make a difference. One of the things where I was brought into with this walking group was some of the sidewalks were cracked, or the crosswalks were a little faded. So it was one of those things. As a partner, I'd go back and say, hey, let's look at updating some of the issues with the infrastructure. But for the most part, it was a straight walk, and there was like one crossing, and that's it. So it made sense. It's one of those programs that made sense. And when I worked for a recreation program, it was very similar to this. It was a short walk. However, it was about a 2-mile walk, which allowed for a private bus to pick up at the public school the kids to the local park. So you have some variation on well, it's a little too far, or it's a little less than a mile, but see what works, what doesn't work, and if there is that kind of agreement where you can walk with the kids after school, it can make for, again, a great opportunity to teach active transportation for years to come. So I kind of talked about, walking from the school to the park. And then now there's kind of the shared use policy. The city of St. Petersburg in Florida had a Playing Close to Home initiative. And this was initiated by the mayor of St. Pete. And it was making playgrounds available within a half mile of every child in St. Petersburg, Florida. So they were installing playgrounds in various locations, keeping the playgrounds within a half mile of every child in St. Pete. And it's not a newer initiative. This was back in 2001, which is super progressive when it comes to active transportation that we think today. But the idea, and this is a quote from the mayor, is people feel differently about their neighborhood if they have to get into their cars or take a bus to get to a playground. Access to playgrounds within walking distance is a quality of life and a civil rights issue. So in a way, it's like it's very progressive for 2001 when we think of like complete streets. Think about our vulnerable road users when we think about connectivity with sidewalks. But it did play a big part in the way infrastructure would come in later on when you have the parks and you say, well, there's some gaps with sidewalks. We need more crosswalks. So it has a big head start with a program like this. It gave a head start for future infrastructure in the area. And the parks are still there. I've been to the park recently, one of the parks recently. But the coverage, if you look at it, they went from 49% in 2001 to 75% of coverage when it comes to the parks within a half mile. So that's about 8 years that this effort took place. And right now, and you got to think a place like St. Petersburg, Florida, which is in Pinellas, it's densely populated. There's not much room to build, especially playgrounds. So it took a lot of partnerships. It took a lot of networking and agreement with how these were going to be built and who was going to manage them. So there's a lot of discussion on them. There's some studies on that online too that you can look at for the Playing Close to Home initiative. So I get that's all I'll talk about with anything related to safe routes to school and walking to parks. But if you would like to, I'm just going to plug one of our other programs that we're doing at Cutter that relates to safe routes to school. If you're interested in more information about that, there's floridaltap.org. You can register for these webinars, but very interesting. We have a safe routes to school series that it's more information on not only walk to school days, walking school buses, but the school siting issues and liability. So check it out, floridaltap.org. Now moving on to older pedestrians. I've had a chance to work with programs and the people that are working with Safe Mobility for Life. It's programs, initiatives focused on mobility for Floridians ages 50 and older. And the idea that not only are many of our older pedestrians, older residents, they're transit dependent, but they need that form of active transportation. Getting out there and getting that exercise, really connecting our communities for our older pedestrians, our older Florida residents. So there are different options. The idea is with Safe Mobility for Life is that they're promoting aging in place and promoting age-friendly communities. We actually have many age-friendly communities with different transportation options. So from our end, we promote safety, but Safe Mobility for Life, they promote biking, walking, transit, even transportation network companies like TNCs to promote this to the older Floridians in the area. But my question to you is, how often are older adults included in transportation planning? That's something to consider, especially for, in Florida, it's a growing population. It's, at one point it's the snowbirds from up north visiting Florida, but now you have more people moving to Florida at various ages. Many are over the age of 50. So, I would imagine that most of our Florida communities are considering transportation planning, community planning, especially for residents over the age of 50. So it's just something to consider. But again, it's active transportation plays a big part in our older population. Some of the programs I've worked on include Alert Today Florida and our partners. We had so many partnerships with this program initiative, really. But we've developed partnerships for the Florida Department of Health and everyone across the state of Florida in over 25 counties. But when you develop these partnerships, you have a stronger reach. So especially with the Florida Department of Health, not only do we have a chance to promote safety, but we were able to cross our initiatives together from safety to health. So, you know, while in my area was safety and very knowledge about safety, I was able to work with many people with the Florida Department of Health to combine our messaging to get the word out. And then you have a broader audience now. And a broader range too when you have these multi-agencies working together. So if you can, you know, think outside the box and bring in other agencies into your world of whether you're safety or health, working together always has a better reach in different communities. I mentioned earlier about Walkability Day. Walkability Day was kind of this idea that came about when I was part of the Partners in Obesity Prevention coalition group that I was with, and we decided to do an event. And one of the things I had been doing pretty much around that time was walkability audits for not only schools but local communities, and they thought that was a really neat idea. And how can we bring this walkability audit and promote active transportation or physical activity? So we came up with Walkability Day. This is 2015, so several years ago. But we wanted our communities and neighborhoods in the Tampa Bay area to take ownership of their neighborhoods. And we provided a walkability audit sheet for neighborhood associations and said, here's your, you know, 20 to 25 sheets. Get your neighborhood associations together and do a nice little walkability audit. And we gave them parameters to do the audits and examples. And they were assessing the neighborhood, the infrastructure, the counts, the number of people walking and biking. There's, you know, fast traffic, or the motor vehicles were going too fast. How many walkers and bikers? The infrastructure assessment. So we gave them all the parameters for that, and they submitted their findings. And it was a big campaign that we did over the course of about a month, and we got many responses. And it's just another program and initiative that you can do that's short term, but it gets people thinking about their neighborhood. So it's nothing that's so comprehensive. It's very simple to do. You just have to have the connections with the communities. Again, neighborhood associations are a good target for something like this to do, and they're always looking for something to do to connect with their residents in their area. So just a thought on that. But it got them out walking, got them out biking, got them talking to their neighbors, and I think that that's a part of what the dialogue we're talking about is active transportation. The reason why I have this photo up here, this is probably majority of everyone on the webinar today. During the COVID pandemic at home, you're working more than you realized at your computer desk. You don't realize you're putting more hours in, and your posture is horrible, and you probably haven't got up from your desk in hours, unless you're just getting food and you come right back. You're not talking to as many people in the office, in the hallways. There's something to that. And unfortunately, during the pandemic, and even still now for many people, they're still at home. And what can you do? What can you do to improve your health, to just get out of the house or home, anything? And one thing that we did this past year was participate in the Love to Ride program. Again, it's a worldwide program, but you may find a Love to Ride program in your area that's specific to your area. It's all virtual online. You can participate as an individual in the workplace, or even a club or group. So if you have a bike club, but it's a bike encouragement tool to get people out and riding. And the Love to Ride, you know, again, it's a platform where anybody can participate. If you're used to using a Strava or something, it connects easily with Strava. But yeah, easy login, connects to all your cycling apps like Strava or Map My Ride. The idea is to encourage others to join. You can earn points, so there's gamification to it. If you have a workplace, if you look on the far right, you can, you know, really encourage your workplace to get involved, and especially if you have an initiative and you're trying to get more employers to join up. It's got this transportation demand management element. It's really meant for transportation demand management programs. But again, you can do it as an individual too, and in your workplace. So check out Love to Ride and see if it's in your area. For the most part, if it's not in your area, you can sign up with the national database. But during the pandemic, this was a great option for people working from home, people at home, to participate in, and it really connected you well with the community. And there was a lot of solidarity too with the pandemic, you know, but it gave people an opportunity to, hey, if they're biking on their own, at least they get to share it. But the health aspect of it is, as you can see this story here, you get to share your stories. Hey, you know, my doctor is happy, I'm out and riding. So, and in Florida, you get that year round. You're biking year round in Florida. So you have that nice opportunity, but there's always campaigns going on with Love to Ride, and this is a part of active transportation. If you think about it, it's one of those things. It's an encouragement and getting you out and riding, and it's a social platform that I think is going to build in years to come, if not so now. But check it out. It's a really neat option. Again, you can use different applications, but one of the cool things is if you have a TDM program, Transportation Demand Management Program, you can actually work with a budget and have your own program for your local community to build through clubs, challenges, and other things. So it's pretty neat, and it does map your ride. Some other transportation options and active transportation in your community include transit, e-scooter sharing, bikes, e-bike sharing, car sharing, and ride sharing. For transit, the first thing that comes to mind, and you all are probably aware of this, but first mile, last mile. You know, when you start, can you walk to the transit stop, get on a bus, get off the bus, and walk to work, and vice versa. But again, there's a lot of this is part of active transportation where you're using multiple options. Even for that last mile, you can walk or get a bike share, e-scooter. There's different mobility options now out there. It's just getting easier and easier to get to your destination. With e-scooters and bike sharing, e-bikes, again, same thing, first mile, last mile, you know, maybe shorter distance, but you're getting on a scooter to go that extra distance that may have taken you longer to walk. This helps reduce vehicle miles traveled if you do use different options, and more people are using it for recreation purposes, especially on the weekends. This is from 2018. Everything is very data driven when it comes to transportation, and from the breakdown from 2018 trips, 84 million trips with the mobility transportation, micromobility, sorry, transportation from scooters, dockless bikes, e-bikes, station-based bikes. So it's pretty cool breakdown to see people are using these in our urban districts and other areas too. And many people have bought their own too. They said, well, I'm using it so much, I might as well buy my own. So there are options for that now. It's not just go out and buy a bike. Now it's, hey, I might go buy an e-scooter or something. So there are new transportation options on the market. Now this is 2019. If you look, 136 million. So we have gone up from 84 million to 136 million rides, riderships. So with micromobility, and we're not seeing a decrease. There was this plateau or decrease during the pandemic, but recent studies show that it's only going to grow from now. So because there's so much interest in it, the way we're building our cities for, again, active transportation, but connectivity and healthy cities too. So these small little micromobility options are taking place in a lot of these cities and areas where cars are not able to go. So cities are planning around it. One of the programs we worked on, an evaluation program back in 2019 actually, but 2020 was the evaluation. E-scooters could have a negative impact on users' health due to reduced physical activities. So basically, we did a survey. According to the survey, 45% of users would have walked or cycled if e-scooters were unavailable. Okay, so there's information on that. But people are out and about. They're out of their homes. They're meeting each other in the urban districts. So you can argue that, okay, they're using e-scooters, but they're not home. They're not doing anything. They're actually out in the communities, walking, still meeting people. And on the weekends, the weekend use was really increased through this study. So you can argue that there's less physical activities, but in a way, I really would argue that there's more interaction, there's more people out and about, and I think that in a way that does improve health and encourages future physical activity and future options. So I do kind of argue on that point and teeter on that, those points. For car sharing, again, very similar to micromobility, car sharing option. It's a parked car, you don't own it, you have a membership, but you may have to walk there, you may have to bike there. And then you drive to your destination, you don't own a car, you bring it back, and that's that. So it's another option for active transportation and how there you have more mobility options tied into one. So if you don't want to own a car, you don't have to do insurance, no gas. All you have to do is be a member and rent. I think that's a good option if you're trying to go carless, because you realize that a car sits in a parking lot more than you ever use your car. So sometimes there's no purpose of having a car based on maybe the area you live. So think about the car sharing as another option. Ride sharing, I mentioned ride sharing, the TNCs with older adults, especially in Florida, they're really promoting this option for ride sharing. But again, it's the same thing with car sharing. It's you're able to walk a certain distance, get a ride, and then walk the rest of the way to your destination. So you do have that form of physical activity, and you're not just sitting in your car and your car in the parking lot. So in a way, it's active transportation, but it's also that transportation demand management where you're using other options, and that's key. Know your options. Finally, with health and all policies, I know in Florida we've worked with the Florida Department of Health to create a community champion recognition program. And the idea for this program is the decision making across all sectors and policies and getting cities and counties involved with this recognition program. Make sure they're looking at this checklist and saying, hey, are we doing everything we can to promote healthy communities? So, and that includes like complete streets and safety, but for the most part, it's a goal of achieving better health as a result in a call to action across the country that encompasses everything from promoting health behaviors to creating environments that make it easier to exercise and access healthy foods. And here's just an example. I mean, if you have health and all transportation policies, you're looking at physical activity, environmental quality, access to medical care, access to food, and safety. So a lot of our cities in Florida are participating in this. Some of them have already participated in this initiative and are on their third year. So it's kind of this checklist where they build their qualifications, and we're able to build the checklist even further. And it's a great thing to have for cities, so they can be accountable for all the policies they're bringing in and all the changes they're bringing into their community. Okay, and a quick reminder, I know I've talked a lot about transportation, infrastructure, and different programs that are happening in Florida, but something that you can apply into your area. But a quick reminder, this from the CDC, you do need to check your health, and part of that is physical activity, whether it relates to active transportation or not. But physical activity can boost your mood, sharpen your focus, reduce your stress, and improve your sleep. So here's some recommendations. So for 150 minutes, walk briskly, light yard work, light snow shoveling, picking up leaves, actively playing with children, biking, casual. It's important to get that physical activity each week. Build your endurance. One thing I like to say is some people say, well, I run a lot and that's that. Muscle strength training is important too when it comes to improving your physical activity. So you can do all the cardio you want, but you got to keep your muscles building as you do that, and also eating right too. So some health tips. And then there's a vigorous 75 minutes, the jogging, running, swimming laps, rollerblading, cross-country skiing, competitive sports, and jump roping. All these things to get your heart rate up. Something to think about. Just to let you know, I didn't want to leave this off. I think sometimes we need that reminder of what we can do to improve our health. Active transportation, it's growing. The connectivity is growing, but sometimes you have to do this on your own, and just a reminder. And that's all I have. But I appreciate the time. Hopefully, there's a few things that you caught that interest you and you can take with you for your future planning or working in your communities. And
wonderful.
Thank you.
Thank you. So we do have some questions. Folks, if you have questions, just please type them in that questions box and we'll see if we have time to get to them. The first question is, hold on, let me turn my webcam back on. I can't do two things at once here. Okay, there's me. And if you want to go ahead and turn your webcam on, and if you want to stop sharing your screen.
Okay.
Great, thank you. Okay, so regarding safe routes to school, any issues with disabled or handicapped students needing to travel a mile to the after-school program?
Yeah, that's important. With safe routes especially, it's promoting all pedestrians to travel to school, to and from school, but it's under the discretion of parents. Parents talking with the schools and figuring out a route really. So would a mile be appropriate? I would say we got to leave that up to the discretion of the parents to decide, especially if a student's in a wheelchair. And that is a long distance to go, but I've seen students do that with their families. So again, it's one of those things you want to leave it open to everyone and you want to give options. But again, it's at the end of the day, participation is up to the parents, and it's good to have that discussion with the parents too, and not have any barriers.
Thank you. Next question. What tools can we use to sell the need for active transportation planning, particularly in communities where perhaps the majority of residents are retired, elderly, they perhaps don't see the need to spend tax dollars on something like this, where there's not a lot of young families, or they can't personally really get around. So what is the point? And I would particularly take this from the angle of the future of that community, and perhaps maybe it won't always be the majority of folks living there being elderly. I don't know. What's your take?
I think it's a good dialogue to have with newer and older communities, with older residents. It's good to work with a resource too, a resource partner. I mentioned Safe Mobility for Life. This is something they do. They have a format to reaching out to the older population and communicating like, listen, the driving time may end at a certain point. You need to be prepared for other options. And that's the reality behind it. And they're like, Safe Mobility for Life is good at that. They're really good at having that communication and saying, this is not unusual. This is something that we do every day. And here's what you can do to get started, to plan for your future without a car. And again, part of a healthy lifestyle as an older resident is knowing other active transportation options. You know, are there other active transportation options? And that can play a part into their daily physical activity. So in a way, there's aging communities where there's, let's say, golf carts, but plenty of sidewalks, and we see a lot of these in Florida, but they're built around the aging population. So there's that option. But if there's not an opportunity to move in aging communities, then you definitely want to provide some kind of options. So it's just opening that dialogue, and sometimes it's harder for the older population to understand that maybe they won't be able to drive after a certain time, or they probably shouldn't drive after a certain time, because there's data that shows that at some point, you know, it wouldn't be a good idea to drive after a certain age.
Okay, thank you. Next question. We have a lot of really good questions. Okay, would it be possible to get a copy of the walkability audit questionnaire? My city is looking to do a sidewalk infill program, and we're going to send around a survey to see if the residents of each subdivision would support a tax assessment for its sidewalks. Thinking the audit would be a good first step. Yes,
there are some resources for walkability audits online already. You can tailor them to your own needs. I can provide what we used. I believe we used a lot of the language already out there for walkability audits. So you just Google walkability audits. You should be able to find something out there, but I can provide you what we had for sure.
Okay. Next question. All right, where's the beginning? Where do we start? What is a good starting point for a city that wants to start planning for active transportation? What is step one to get things moving?
Step one is to plan it out. Like, I wouldn't say start small, but like I said, what can you do tomorrow as opposed to 10 years from now? So you have some kind of comprehensive plan. You have your long range transportation plan, but then what's the short range? You know, what's something that you can do tomorrow? Like you mentioned, the paint. What's something that can really build the pride in a community? You have events, you have activities in the community. Like I said, City of Tampa's done so much with their painting options, which low cost. What's something that's low cost? And then you build from there. That's one option. It's having a dialogue with the city partners, what they want, what everybody wants to do together, and how to collaborate. And I mentioned that with the city of St. Petersburg when they did the Playing Close to Home. You know, it does take a partnership to start, and it shouldn't be one agency doing it. It should be multiple agencies working together, not only to manage some of these transportation areas, but you know, it's starting there. I would say communication is key, and then the public input. You know, what does the public want? What does the community want? If you have a really engaged public, you need to do some form of a workshop or community meeting where you can get some feedback from the public and see exactly what they want too. And that would maybe be the first place to go, doing what the public wants or needs.
Okay, so I'm gonna unpackage what you said a little more.
Okay.
So one of the steps would be, you know, initially getting the public input, and perhaps once you get that input, you either move on to step two or you step back and go, okay, so the public might not necessarily be on board yet, so we need to do a little massaging. So at that point then, how do we communicate with the public? Again, kind of like the question that we just had about elderly residents. How do we convince them that this is something that's important?
So one thing that's worked in the past is using best practices from other communities, showing examples, you know, something that's more data driven for the community, that you wouldn't show an example of a larger city and you're working with a smaller city. So something that's, parallel to the city you're working with or the community you're working with. And it does take conversation. It does take somewhat of a cultural change and more buy-in. And that can be very difficult to get buy-in from the community. But, if you have enough community partners, I don't see why you can't really bring more people into the table from other parts of the community instead of maybe you're just regular attending community public that's always there. Bringing more people to the table. I think that's important. And more people that are aligned too with some change that can benefit the efforts.
Okay, let's talk about collaboration then, because you've mentioned this now several times that a process like this and bringing active transportation it's not just for planners, right? Like it's crossing over many sectors, many complementary sectors. Who do we want to invite to the table here? What other types of organizations, government entities, who do we want to bring to the table to have this initial discussion and say, okay, this is what we want to do. Let's figure out how to do it. We want all of you involved. We need all of you to kind of rah to the community to get them on page. Who do we bring to the table?
I'd say the one good approach, it's a little different because for my area, if you think, well, where do we start? Countywide, very large county. I'm in a very large county, one of the largest counties in Florida. And you wouldn't be able to really start countywide. You can promote, talk about it, but you could start with your urban districts. I think your best part is to start with your downtowns, with your city. I know that sounds obvious, but I think they have the largest voice. They have the largest voice, the largest examples they can provide. Again, social media is a big impact too, like sharing of social media on the different changes that are happening. But when you talk about bringing partners in, if you're within an urban central business district, you have so many partners in the area that can collaborate, but you need that one voice to share it. So if you have a really vocal city, it's important to get a mayor involved, to get social media, get some social media outreach. Again, you reach more people through these different platforms now on social media. So I think starting with the city, not so much countywide, but city, and then branching it out that way, connecting with the counties, obviously bringing in your Department of Transportation, your Department of Health, your research centers, universities, anybody that can get involved. But it does help having agencies closer together, and sometimes that happens to be in the urban districts.
Okay, so what do we do if we live in a small community? What if we're in a rural area? What if really the only other entities that we have to rely on might be like a regional transportation organization or a county? We're just a small township, or what do we do? We don't have the resources. Who can we turn to? Who can we ask to come to the table?
Yeah, well, if you get to the rural part of it, that can be a big challenge. Like, who do you turn to locally in the rural areas? I'll start there. One thing you can do is connect with the different neighborhood groups, neighborhood associations. Believe it or not, rural counties do have those. They just meet in certain locations. You can start there. You can, try to hold county workshops, different locations within the area. Again, getting more public input on what they need, what they want for different changes maybe you're proposing. When it comes to little towns, smaller towns, you call them little towns, but smaller towns, it's finding public agencies locally to build that dialogue with the community. And most of them do have that connection with the community already. So you could have that at a town center, but it's one of those things you want to hold an open house, I think, to really begin that discussion of what they want.
So for all of those listening in, before we started today, Jason and I were talking about how, I live on Lake Erie in Northeast Ohio, and he is in what I'd consider to be hell in Florida. The heat is, I don't like the heat. But we were talking about our different types of weather, and talking about how different activity and active living can be depending on where you live. So I know that you mentioned being active in the wintertime, for example, like shoveling snow, which let me tell you, that gets your heart rate up really quickly. But for those of us that live in climates, where it's not 80 degrees every day, how are we able to incorporate, active living and active, transportation? Things like scooters and bicycles can be very dangerous in some of the winter months, depending on where you live. If, a lot of times in urban centers, the sidewalks are well taken care of and they're salted. Same thing with the roads, with the roads when you have bike lanes and things like that. But even in the suburbs where I live, you're saying a prayer when you get on the road in the winter months. You don't know if you have black ice or what. So anyway, my point is, I'm rambling on. My point is, what can we do about those communities that have a climate that just isn't good for an active lifestyle like that during the winter months?
Well, I'll say this. I don't have any experience living up north when it's during those climate changes during the winter months. But I would recommend, the sidewalks are still there. There's still connection to transit. Scooters may not be a viable option. Could be more with the slicker roads. I know a lot of these scooters, shared scooter programs, and personally owned scooters, the tires are much larger now for maybe the northern states where the weather does impact those options. So I've seen larger tires, which could help with riding along the snow. But in a way, it's to increase your physical activity during those winter months. I would work out indoors or find a local gym. But for active transportation, there's still that option to walk to transit stops. There's park and walk locations. You can park your car, walk to a transit stop. There are just know all your options. Every community is different too. So it's, in a way, it's difficult for me to answer because I'm not sure what everybody's going through and all their options in their communities. But park and walk locations, we do that here. And I mean, honestly, we'll have torrential downpours, and those park and ride locations where you're picking up a transit bus. It's another option, especially during the rainy months, which, at 5 o'clock every day, it's downpour. So, you have your snow up there, but we have our downpours. But again, if you don't know all the options in your community, it's something to consider. And if you don't know, then obviously your public doesn't know, and find a way to get that information out to them.
And I guess the same could go also for those that live in areas with extreme heat as well, because extreme heat can be just as dangerous as snow and slippery roads as well. And I guess I would submit I'm thinking about when I was in high school. I took a public bus to school, and my bus stop, it didn't have any kind of shelter. It was just a stop. And on more than one occasion, I had to dart backwards because either a huge wave of water from rain or a huge wave of just snow and slush was gonna just completely soak me because cars were driving too fast. And I'm wondering if an opportunity would be for communities to take stock of all of their bus stops and the areas, the hubs where e-scooters tend to live, things like that. And engaging with dialogue with the public, and even with Public Works to see if there are opportunities to make those a little bit safer, particularly during those winter months. To the topic of like e-scooters, things like that, this question is, what types of vehicles should be allowed on non-motorized trails. So as pointed out in your presentation, a lot of communities are using e-scooters. Some public trails allow class 1 e-bikes, but not class 2 or class 3 e-bikes. Should motorized unicycles that apparently can go up to 30 miles an hour be allowed on trails? What about e-skateboards, segways, golf carts, mini motorcycles, all the things that can go fast but aren't considered, I guess, motorized? At what point does it become unsafe for some of these, micro mobility groupings,
Yeah.
I guess?
Yeah, I guess we'll start with e-scooters and micromobility like e-scooters are not allowed on a lot of our trails, especially state trails, specifically for pedestrians and bicyclists. I'm sure there's some loopholes there with other vehicles, but one thing we are seeing is e-bikes on our off-road trails. And at first people were very, hesitant, like, come on, e-bike on a, it's a mountain bike, mountain bike on a trail, on a off-road trail. But you got to think about the users. I mean, you might have someone who's older and they need that little extra support, and it does help. It really does help. And we've had a lot of people attest to that. It gives you that, extra push to make it to the next trail. So I think, e-bikes on the off-road trails for that purpose can definitely help, because that can be a challenge at some point, at some age. You might say, well, I'm not going to do this anymore. But if you can allow it, and then now you have another age population starting to use the trails more as a physical activity, physical activity for themselves, then you're giving more options to other people with this type of vehicle. So, but I have seen the e-bikes, not the e-bike sharing, but actual e-bike off-road bikes on trails before, and it brings more people to the table. So, but as far as having an e-bike or a e-scooter on a flat road trail, which we have many of those in Florida, I mean, I don't see that happening.
Okay, let's talk about sidewalks for a few minutes. This is a particular passion of mine, I guess. I don't understand why there aren't sidewalks everywhere. I mean, I do understand why, but what are your thoughts about requiring them in zoning codes, like in plan unit developments, subdivision regulations, things like that? Do you think is it worth it? Does it really work? Even in just main arterial roads that might have never had sidewalks before, should they consider them? What do you think? What should folks do regarding the game of sidewalks?
Putting on my safety cap, I'm going to say sidewalks should be everywhere. But in my area, in the county I live in, I believe there was at one point a policy where sidewalks only had to be on one side of the road at some point. And I live in somewhat of a older, Tampa's somewhat of an older community too, some parts of Tampa, and there are no sidewalks. So sometimes you have that right of way that's not there, and maybe around the corner you have another sidewalk. But let's see. An example of maybe sidewalks being installed would be with the schools. Like some of our schools are built kind of in a rural area or kind of the outskirts of town. I'm not sure where they're at with building newer schools right now, but I read an article recently where there was a school being built, and then the school district was responsible, the community, of installing the sidewalks in front of the school for future connection, because they're planning for some development around the school. So while there's no development now, they're planning that in the future. around the school that's being built. So I do believe that businesses should have a stake in and a part in the sidewalk infrastructure around their developments, but there should be, again, some kind of uniform code so everybody's on the same page. Yeah, I do think developments should, especially in the urban districts, should have some part in that, in the installation of sidewalks.
Okay. Do you have any best practices for incorporating sidewalks in a zoning code? Like requiring them in PUDs, for example?
Oh, I can't think of any. I know there were several within the city. I can't think of any examples right now, but nothing that I worked on.
Okay. This next question actually is something that I've been thinking about lately too. For communities that either don't have sidewalks or sidewalks are meant for people only and not your e-scooters or your e-bikes or things like that, and there are designated bike lanes, is it safe for people that are using these forms of microtransportation to use the dedicated bike lanes? Is that what it's meant for? Or is it just meant for cyclists?
Well, it wasn't really meant for e-scooters, I guess initially. I know Florida had a policy on that e-scooters can ride in the they follow the same rules of the road as bicyclists in Florida, at least. I'm not sure how it is in the many other states. We're seeing some of the e-scooters ride in the bike lanes, but for the most part, sidewalks seem like the most designated place, especially for those e-scooter share programs. As far as some of the bike infrastructure, especially in the city of Tampa area, downtown area, there's a cycle track, so that's obviously used for e-scooters as well. Do I think that they should ride as a vehicle, like a bicycle? And I would say yes. I think if people were bicyclists, they'd understand that actually riding an e-scooter in the bike lane would be a lot easier. But one of the reasons why I think many people won't ride a bicycle is because their interaction with motor vehicle drivers. So I don't know. I do feel that it's an appropriate place. However, riding on the sidewalk just seems easier. Again, I have an e-scooter myself, so I've experienced this many times where around my neighborhood, I'm riding in the road. It's easier, slower speed traffic. Higher speed traffic, it's not gonna happen. 45 miles per hour and over, it's not gonna happen. Bike lane, if there's a sidewalk instead of a bike lane, I'll probably ride on the sidewalk. So it's all personal preference, but I do think in a downtown business district, riding in a bike lane downtown makes sense. It's less interactions with the pedestrians, but around the neighborhood, I'll ride it in the roadway or the sidewalk. There's just that form of caution when you're riding around the neighborhood because you have other pedestrians. I don't know. I teeter on both sides, but for the most part, I think they can follow the same rules of the road as bicyclists and ride in the roadway with the bicycle infrastructure.
So when you're kind of putting on your safety hat, let's talk about for a moment, when we're thinking about active transportation and, maybe communities haven't thought about it yet. One of the things to think about, I would suspect, would be looking at the streets, looking at how complete the streets are in terms of, their safety and the amenities to make sure that you're keeping the pedestrians or the cyclists or the e-scooterists, whatever it is, making sure that they're safe. At what point in the process should you be taking stock of your streets in terms of how complete they are, how safe they are?
Yeah, I think with a few of the cities I live near, they're definitely taking that inventory on, considering infrastructure that fits micromobility more, and what the users are doing. The cycle track that's downtown, it's a nice designated spot for bikes and e-scooters. There's a river walk too downtown where e-scooters are not allowed. So it's kind of geo-fenced where, okay, it's a cutoff point. You can't ride your e-scooter any further. And that's for safety reasons. There's so many people walking on the river walk. But I do see that cities will start taking more inventory on, how they can accommodate micromobility more in the future. I do see that. That's going to happen. How they're going to do it, I think they're still investigating. But if they do treat the e-scooter like a bike, maybe there's going to be a little more accommodation for a faster moving vehicle, especially for riders who decide to ride 15 miles, 20 miles per hour on an e-scooter. What could be the safest infrastructure for someone who may not be following the rules of the road or maybe following the rules of the road? What safety does come into play here, and when it comes to like how they're riding. So, for example, many of the e-scooters riders downtown will ride on the sidewalk, and there'll be kind of a collision course between the pedestrians and the e-scooters at the curb cut, right at the crosswalk. What do you do? Best thing to do is just get off your scooter and make sure that the pedestrian can walk safely. So these crashes, these types of crashes are being reported and used to assess future infrastructure. I think that is happening. But again, I don't know what that's going to look like. It could change the way we build our infrastructure around micromobility. But as I mentioned before, some of our communities are going carless. So you will have to park your car outside the, let's say, urban district and then walk, bike, or take an e-scooter in. So again, this infrastructure in the future is going to look a lot different because it's going to be carless. They're going to really take the car out of the equation.
One last question, I guess, or maybe it's a comment, and it just makes me giggle because I haven't heard this term in a couple years. A VUNERF, which is, I think it's a, I'm trying to think of where, the Netherlands maybe? And it's just a term, essentially, it's like a living street or a complete street. And they call them VUNERFs. And it says, we are promoting these in PUD development. It's a great alternative to just adding more paving and gives pedestrians and cyclists priority over cars. So I guess, that's another thing. Do you have any comments about, kind of really honing in on the design guidelines in a PUD to sort of build the frame of, a good living street?
I can't talk to that, but I can talk to some of the ideas like a nearby city had, I believe city St. Petersburg, but I could be wrong. Similar to the Netherlands, how there are different tiers. Still the motorists are still involved, the motor vehicle drivers, there's still a car, but there's different tiers. There's a sidewalk tier, the bike tier, along the same path, but it's a different tier that they can ride connected to their network. Well, maybe there's going to be a kind of a micromobility e-scooter tier where it's, you have an e-scooter or e-bike that goes a little faster than a bike, definitely faster than a pedestrian, but it's their kind of right of way. I can see more of that happening. Again, some of the issue is gaining that right of way and, getting that access for individual modes, especially for a city like you mentioned, Pinellas and city of St. Petersburg. It's just so dense and already built. It's hard to gain that right away and create these new networks for future transportation. So, but that's one example I heard a few years ago, and I'm like, I haven't checked if they completed or started that project, but they're mimicking a lot of what's going on in the Netherlands. So I think if you can do something like that, use those infrastructure ideas that they've had for years that seem to have worked and change behavior, transportation behavior for the better. I think that's exciting, but a lot of the stuff our cities are doing now in other states, not just Florida, they're creating these best practices where you can copy from what's happening over here in the United States. So, because a lot of our cities are very similar. You know, you just find a similar city and what works and what matches.
Great.
Hopefully I answered that question.
Yeah. And if anything, I get to say Wunderf. Well, thank you. Right. Thank you for joining us. Everyone, as a reminder, we are recording this session. I'll post it up on our YouTube channel. And I will also post a PDF copy of Jason's slide deck up on our website, ohioplanning.org/planning webcast. Reminder, the session has been approved for 1.5 CM credits for live viewing. So don't forget to record those. And don't forget to register for all of our upcoming sessions that we have. And finally, thanks to APA Florida for hosting today's session and Jason Jackman for being our panelist today. It was a great discussion. I had a good time and I thank you. Everyone have a great weekend and we'll talk next time.